On a lighter note, jumping into the agenda, just to give you a quick overview. It's going to be a broad policy update, and we'll try to get into the weeds a little bit. We're going to go over a recap of the elections, lay out some big picture expectations, cover key legislative issues, hopefully gather some feedback about the order of importance for purposes of prioritizing, summary on the Indian Health Service Summit, and make a call request for compelling stories to help us later to be more effective in our advocacy, offer assistance and support for advocacy and technical assistance so that we can match membership needs and the different levels where people are at, and then open it up for questions and contact information so you all can follow up and we can begin working together. To jump into it, the 2014 midterm elections, assessing the outcome. As you all know, just through the news, Senate takeover by Republicans. They control both chambers. This gives them the power to set the agenda, literally and figuratively. Just this morning, the leader of the House majority put out the schedule, so we know which days are in session and which days we're not. So when people come to DC for meetings, I can help you know when the member's going to be there, so you can try to get that face-to-face time as an example. And then also, it gives them the authority to determine the issues that are brought up for debate. So they have a lot more. Influence in the media to, persuade the public, and they can block the president's priorities more than they have to date. It's, as you heard, the largest majority since 1949. So it's a pretty, it's looking like it could be many years, at least on the House side, for any change in that power balance. It's also important to take the context into consideration, and this is important for looking toward what's to come. While it's the biggest takeover and largest majority since 1949, this was the lowest voter turnout in 72 years. Exit polls cite polarization, fears related to Ebola, ISIS. While the economy is improving, people don't feel it, are tired of the status quo politics. Congress has toxic approval ratings. Many of the states where the elections were decided were conservative-leaning states. There were issues with voter demographics, voter access, ballot initiatives that made it to where voters had to bring multiple forms of ID and mail, proof of residency to verify their citizenship. So a lot of those things were barriers that people say hindered turnout amongst minorities, young people, and people in rural places like Alaska, where the election came down very close, but they have a lot of challenges when it comes to physically voting. So, looking toward the 114th Congress, the reason why we should expect gridlock and divided government is because while the Republicans have a majority, they don't have enough to pass major bills without reasonable Democratic support. So there's still the expectation of divided government. The president possesses veto authority. Now that Congress, both branches of the legislative branch, they're very aware that they have to showcase accomplishment because they've mostly ran on opposing the president's policies. So now that they have the authority, they're expected to produce. And the reason why that is going to be difficult for government functioning is because they ran on spending cuts, smaller government, specifically the repeal of the Affordable Care Act, and they've said if they can't do it from a top-down approach, they're going to do it from a bottom-up. So they're going to look at slashing funding for specific programs, initiatives to undermine ACA, therein IHCIA. So those are some reasons why we shouldn't expect it to be, everything they've been saying in the news. We're going to work together. We're going to get things done. That's what they're saying now, but time will tell, and let's hope they do. The other reason is because the Senate election that's coming up as part of the 2016 presidential election, there are 23 seats that are Republican seats that are up for re-election. This last time, it was mostly Democratic seats, and there weren't as many. So with some major front-runner on the Democratic side and not a clear front-runner on the Republican side, it could present an advantage to the side with the front-runner, and if they can win a plurality, it will be a ballot, it will be a down ballot victory. So there's not incentive for the parties to really work together because what we've been seeing every couple years is one side's just they're trying to do a winner-take-all approach, but each election it's just kind of going back and forth, and the American people have always done that, gone back and forth. So those are reasons why we don't expect it to be kumbaya up there on the Hill. So what should we do, in Indian country and as UIHPs? Intensify advocacy and outreach. We need to, we have positive relationships amongst both parties on key committees, appropriations. We've seen Indian health services increases throughout every year of Obama's administration, while it might not feel like it, except in 2013 sequestration, and of course that doesn't make up for historical shortfalls. But the trend is in our favor, while we need much more support. The momentum is on our side. Additions to Title V line item for urban Indian health programs is going to really require much more policymaker education. Outreach needs to be strengthened and sustained. I think it's probably one of the areas where there's the most potential for funding increases because of the population size. And so what we want to do at NCUIH in the policy realm is to improve our service to membership, to coordinate effective strategies, and we really need an all-hands-on-board approach with this so that it's not all based on what we're doing in DC, but what each of us are doing where we are. Therefore, as an example, connecting with staffers, field representatives, if you aren't already, and I hope you are, but being in connection with field staffers for the representative in your district, for the House, and then also each side of the Senate. We want to be able to provide you background info or get you in direct contact with the point person in each of those offices. The goal for every UIHP, if it isn't already happening, should be a site visit each year by a member, senator, or all of them, so that they can connect with your community needs face-to-face and personalize the impact of shorting funding shortages, but also so that you can highlight success stories and show them how you're being good stewards of federal resources. As for legislative priorities of NCUIH's, because of my newness and Congress being out the last 2 months since I started, I don't have a precise update on the status related to the Federal Tort Claims Act, to include UIHPs under that. that language fix or the 100% FMAP. So in short, simple terms, we need to get passage on that, and I can't tell you where that's held up in the process, but I will by our next meeting, and I hope to provide you policy updates with much more specific information on where we're at and how we can all make that happen. For the definition of Indian, as it relates to the Affordable Care Act, we have the 3 different definitions, one for the enrollment period, one under the cost-sharing section, another for the IRS exemption. As we speak, the Medicare, Medicaid Health Policy Reform Committee is crafting strategies to pursue for next Congress. The administration has said that has to be a legislative fix, so that's the approach, and we'll have more information about their recommendations, and that will be a collaborative effort with NIHB and other partners. With the Medicare-like rates, June 12th, Congressman Betty McCollum from Minnesota and Congressman Tom Cole, both co-chairs of the Congressional Native American Caucus, introduced the Native Contract and Rate Expenditure Act, CARE Act. There's concerns from the American Medical Association, so they're trying to rework some language so that can get introduced next Congress. Under the Special Diabetes Programs for Indians, also part of the DOC fix, on September 16th, Chairman Tester from Montana introduced a bill for permanent reauthorization, which is likely not to be passed during the lame duck, and reintroduction of that next session will be necessary. On advanced appropriations, this is a really tall task with the changeover and control of Congress. Veterans help receive this status, and we're hoping to follow a similar strategy and take approaches that, really, again, personalize the lack of responsibility that the government is taking, in fulfilling its trust obligation. So we just hope to learn a lot from them on that, but it really, again, that is a tall task because of the changeover, but it's something that deserves our efforts. With the IHS Budget Summit that occurred October 13th and 14th in Washington, D.C., there was a lot of board representation there, which was a really positive thing. I was able to be there. As you can see here, the forum featured dialogue among tribal leaders, technical advisors, experts, government representatives. There was IHS Director Robidoux, White House Special Assistant to the President on Native American Affairs Jody Gillette, Appropriations Staffer, National Indian Health Board, Congressional Relations Katrin Shai, health economists, policy experts, tribal leaders. They did an overview on the IHS budget, a recap on the recent levels of funding. Recommendations were highlighted for the need for more Capitol Hill advocacy and education. For the budget consultation process coming up, we're asking of you to collect compelling stories on the struggles and successes with healthcare access in your community. So if there's some powerful personal narratives, that's something we want to follow up with you on to gather, because those are what will help us when it comes to those funding increases. To give you a specific example of the power of personal stories, former Senator Byron Dorgan started the Center for Native American Youth with funds that he had left over when he retired from the United States Senate. And they're doing really incredible work, providing comprehensive resources on scholarships, fellowships, programs, conferences for Native American youth. And this coming week, they're going to be bringing out the actor from Twilight to do an event there in D.C. And, really, the reason why I say these compelling stories have a major impact is because he always tells stories about specific youth that he remembered meeting and hearing about their struggles. And so those stories can really impact these legislators on a personal level that make them advocates and allies for us. And then last but not least, the advocacy and technical assistance. We want to make sure that we're offering as much support to you all as we can, advocacy trainings, legislative research. And this can be on something short and simple. It can be on a very specific issue, tracking legislation. If you're coming to Washington, D.C., you want to meet with your member, or if you just want to do a tour, anything we can do to support you during your visits, drafting testimony, as I mentioned before, in district or D.C. House and Senate staff contact information, policy briefs on specific issues, congressional correspondence, just looking over it, helping you draft it. And another example of something that we want to do and work with specific communities on are hearings or briefings so that we can increase awareness about the issues that are faced by UIHPs. I happened to meet a congressman at a reception from LA, and he's ready and willing and wanting to host an event on Capitol Hill to highlight some of our challenges. So, once we can, come up with a plan for that, we can follow up with him and reach out. So, we can do that not just in D.C., but we can do that in your communities as well. Have them host a roundtable. Those are things that we want to help with. And finally, I want to open it up for questions, discussion, to hear from you all what priorities should be, any feedback that you have for us, for me, or anyone that just wants to offer suggestions, comments, concerns. So
I don't have a question, but I'm so glad you're on board, because the last few trips I've had to the Hill, they said that they haven't heard anything from the urban Indians in some time. So we definitely need to become more visible.
Thank you. I agree.